I'm Jordan Spencer. I'm a internal medicine physician, addiction medicine physician, and a psychiatrist. 40% of what I do is addiction, and the rest is just broad general psychiatry. In my clinic, we do a decent bit of treatment-resistant depression. So we have novel mechanisms here, such as TMS, Transcranial Magnetic Stimulation, as well as we offer Spravato, which is a S-ketamine. So it's a nasal spray form of ketamine for treatment-resistant depression.
Hello, everybody. My name is Ruben Burney, and welcome to One Moment Podcast. We have a special guest today. His name is Dr. Jordan Spencer. He's an internal medicine specialist and an addiction psychiatrist as well. We also have the co-host, Kevin Odom and Trevor Zostry.
My name is Kevin Odom. I am a licensed clinical mental health counselor, a licensed clinical addiction specialist, and a certified clinical supervisor through the Substance Abuse Board here in North Carolina.
And good afternoon, everyone. My name is Trevor Zostry. I'm a former correctional officer with experience in high-stress environments and mental health facility activity. Thank you very much for letting me be here and be a part of this podcast. For sure.
I'm a counselor. I've been in the field 25 plus years, and in addition to being a counselor, I do other things on the side. I shouldn't say side hustle. I have a business called Live and Thrive, and through that LLC, I do other things, and just enjoying being in the field and learning at 69 years old of age, still willing to. They say you can't teach an old dog new tricks, but I'm learning through this podcast. I'm not an expert at anything, but I've been in the field 25 years, and I'm learning through this podcast. So we'll allow our distinguished guest to introduce himself.
I'm Jordan Spencer. I'm a internal medicine physician, addiction medicine physician, and a psychiatrist. I practice out of a small practice called Barrier Island Psychiatry in Charleston, South Carolina. I do vast majority of, I'd say 40% of what I do is addiction, and then the rest is psychiatry, just broad general psychiatry. In my clinic, we do a decent bit of treatment-resistant depression. So we have novel mechanisms here, such as TMS, Transcranial Magnetic Stimulation, as well as we offer Spravato, which is a S-ketamine. So it's a nasal spray form of ketamine for treatment-resistant depression. And then I guess it's a side hustle, or I don't know what to call it, but I've also been working on something on the side and have a up and coming business called EQ Unplugged, Emotional Quotient Unplugged. And it's an app that will, using AI, will listen to a conversation and then give you feedback on not only your communication skills, but your emotional intelligence.
Thanks for that introduction.
Yeah, no, that was a great intro. And so, I know that we know, because we were talking yesterday. My first question is for the audience here, how long have you been practicing as a, within the addiction field?
So as a full-fledged attending physician, about 2 years now. I did 5 years of residency, where I was a learning physician. And then before medical school, I worked at a rehab for about two and a half years as a psych tech. So that's probably where I'd say I got my roots.
Gotcha. So I know yesterday we were talking about a lot of things as far as the intro. We covered a brief, kind of brief area on everything. So, with our background, Ruben and myself in addiction, primarily addiction, I guess I'd like to start there. And you do a lot of stuff within the psychiatric field. So one of my questions to you is there's a lot of, right now there's a lot of hype on MAT, right? I'm up here at NatCon, and we have a great psychiatrist that spoke the other day, and she was like, and I want to get your thoughts and experience on it, but she had said, and I cannot pronounce her name, so I'm gonna say she. She is a brilliant psychiatrist like yourself. But she said, I'm tired of hearing MAT being the gold standard.
Hmm.
Right. Right. And then she said, what I push for is MAT and neurology, MAT connection, MAT primary care, MAT community, MAT 12 steps, right? Like, and so she was emphasizing all of these things, right? Instead of ACEs, it's called PACEs, which is positive childhood experiences, right? So she had this, taking this status quo and rebuilding it from a different perspective, right? And she challenged all of us yesterday to do that, right? Regardless of your position. So my question to you is, working in the addiction realm, right, as an addiction medicine, psychiatrist, what are your thoughts on some of that information? And what are your experiences on in that realm? And then I have a follow up question. You said something about TCS, I think it is, or
TMS. Mm-hmm.
Yeah, TMS. Thank you. Have you ever used that in relation to other stuff in the addiction realm? And so, what has been the outcome of that? So that's kind of where I would like to kind of start at.
Love it. Yeah, great questions. So I would agree. MAT is awesome. I will be the first to say MAT saves lives. When I'm writing something like Suboxone for a patient, I am viewing myself as someone. I'm providing them something. Like, yes, does it help curb cravings? Does it make it so that they're not thinking about they're using anymore? Does it make, yes, it does all those things. But at the end of the day, what I really see myself doing is I am creating a force field against heroin or fentanyl or whatever, making it so that if they use, they don't kill themselves. If they use, they've got this something blocking those receptors, especially if they've been sober for up to 2, 3, 4, 5 weeks or however plus. If they use as much as they were beforehand, they're at a super high risk of overdose. So I definitely think MAT incredibly important, but it's not complete. Anyone who, if we just throw Suboxone at people and call it good, we're doing there. There's a difference between sobriety and recovery, right? And I would say someone is sober if they're not using substance, if they're on MAT, but they're not in recovery. They're not building themselves as a person. They're not becoming that new person that we're hoping they do become. And that's where we do things like we do IOP programs and we integrate. I work closely with an IOP, and the skills that they learn, it's DBT based, and DBT is just thebomb.com. And the growth and development that they get from that is nothing I could do in my office, just me and them. They need that group. They need that feedback from each other. They need the DBT skills book. So I totally agree. MAT is the gold standard with everything else.
Yeah, I find good you said that you integrate that, because I find in this area a lot of doctors think they do OBOT treatment, office based opioid treatment, and sometimes patients say the missing part of that is, they do the drug screens and what have you, is having that counselor or that therapist on staff to follow through. And I find a lot of them who are getting into that now are hiring counselors or therapists, or refer them as well to integrate, because even where I work at, we're a medication assisted treatment program. And I find newcomers oftentimes feel that, okay, I don't need counseling as long as I get my methadone on my Suboxone. And we try to explain to them or motivate them that, counseling is a part of it. You, like you said, that force field, but you still have to dismantle those addictive thinking and behaviors that develop with your addiction. So, and that's the challenge sometimes, getting new patients to see that, because the ones who are in recovery, they value that, and they value counseling. I don't have to play this mouse and cat game, or whatever you want to call it, and with them, but with new patients who are active in addiction still, it's like chasing them. And, I'm like, and trying to explain to them the value, get them to see the value of counseling or therapy or whatever. You know what I mean?
Yeah, I would say the difference is MAT treats the body, the counseling and therapy treats the person.
So here's something that's going to throw everybody off, including the doctor. In the correctional field, there is no MAT allowed because these individuals are in an enclosed environment, in a secured environment that they cannot, and especially with Suboxone. Suboxone is a huge problem on the interior of a secured facility. It is not allowed. And what it is used for is the new high. So it's problematic in the sense that just automatically saying, and the people on the outsides of these facilities have the option to get the treatment that they need, and I'm open to that. That's great. We want to see these people stop using the things that hurt themselves or hurt others that they're involved with. So the problematic part of it is that, and I've even made a huge discovery in a facility that I was at, searching through a facility-wide event, and found a huge amount of Suboxone that they were using and had stashed away in a place that they could use it as another source of getting their high from. So I don't want to say that MAT or Suboxone itself is a bad thing, but at the same time, from my perspective and my experience with it, it was, I was horrified. I'm like, oh my God, the money that they're making out of this, the buzz that they're getting out of this is totally not allowed. So but I can't say that I'm not open to what's being accomplished through using Suboxone for what it's supposed to be used for. I get it, but in a controlled environment, it's just a whole different ball of wax.
Time and place, I think, is what comes to mind. Like there's a time and a place for certain things, and I think people, because the high, my understanding is the high from Suboxone is pretty lame, and but you've got people in prison or jail, whichever, who they're looking for whatever they can get, so they're gonna take a bum high. But yeah, a time and a place, and there's a right time to use things, and there's a wrong time. There's an injection form of Suboxone, right, that lasts a whole month. And I'd say in the prison setting where they can administer that appropriately, abso-freaking-lutely. Um, but yeah, maybe it could be passed around. I mean, Seroquel, which is a medicine that we use in psychiatry sometimes, they find, I think if they crush and snort it, they can get high or something like that. It's like they'll find ways. But no, I agree. Time and a place.
Trevor, I think it's changing. I know in North Carolina they have we're trying to work with uh, patients of ours who get incarcerated, and I believe one of the counselors did talk to the establishment there at the prison, and that patient was allowed to go in there with their methadone. Now in Rikers Island in New York, they do have a program where they administer methadone to those who are opioid use disorder. So some places are changing and accepting that. So yeah.
Yeah, those types of medically assisted treatments are specifically done by the medical staff and
Yes.
has to be on a scheduled regimen that they have to remain applied to, or they're non-compliant. And when they go non-compliant, if they decide not to or to do the MAT treatment, then that's another process of itself. So yeah, it's just very discouraging. I even heard you say Seroquel. That is another thing that they use on the inside. Something that's extremely dangerous to us. And we did an episode where I had mentioned before about fentanyl. The amount of fentanyl that it takes to kill someone is only the size of 2 crystals of like a salt shaker. And it's terrifying. The exposure to that by the staff on the inside, where you're trying to keep everybody safe, and they're still getting somehow these things inside these facilities that they're trying to get their fix from or whatever. And it is putting everyone's lives into a detrimental bad situation. So it's just there's so much on the behavior on the inside that needs to be addressed specifically for the ones that are keeping everyone in safety and the ones that are doing the things to harm themselves. They need to have that help too. So it's like a revolving thing where everybody needs to help everybody.
Absolutely. No, I am right there with you, Trevor and Ruben and of course you too, Dr. Spencer. So and everybody, let's welcome Miss Monica to the show.
How are you?
You don't want to be seen, I guess.
Oh yeah, I'm sorry. Let's welcome Monica to the show. So she has never I don't know if she's ever done a podcast, but this is her first time with us. So so she is a dear friend of mine, also works in the healthcare field. So Dr. Spencer, with that T, I'm gonna mess that name up
Yep.
again, right?
Yep.
With that, right? Do you have you used it for addiction in your addiction work? And tell for the audience who don't know about it, what is it? Okay,
Mm-hmm.
and of course, have you used it for addiction? And what has been the outcome that you have found?
So TMS is transcranial, so through your cranium, magnetic stimulation. So it sounds science fiction, but what we do is we get a magnet and we put it near someone's head, and it's an electromagnet. And when we put a current through it, right, when you put a current through an electromagnet, you turn it on. So, you turn it on and it picks up the spoon, you turn it off, it drops the spoon. So we put one near your head, and then we very rapidly, the machine will turn it on and off. I think it's 40 times a second. It's 40 hertz. So, and what's happening is there's some really cool physics behind it, but basically we generate an electric current about 3 to 5 inches away from the electromagnet. So by doing that here, we are stimulating the brain. And so the way, like when we're trying to find what the right dose is, for instance, we put it over this part of our brain that controls your right hand, and we will have someone hold their hand up like this, and then we will do one pulse, and we know we're in the right spot when their thumb twitches. And what we're doing is we're creating an electrical signal in just that one teeny tiny spot. So one thing I like to emphasize, this is not electroconvulsive therapy. This is not One Flew Over the Cuckoo's Nest. It's not the full creating a grand mal seizure through electrical shock. Not at all. The person is 100% conscious. They're awake. They talk the whole time. They can talk to you the whole time. They can watch a movie. They can whatever. So we send a signal, and then what we do is we put the magnet over a certain part of the brain that when people are depressed, we find is down-regulated. It doesn't have as much stimulation as it normally would, and it's almost like jump-starting the car. We send enough signals through it enough times that the brain itself picks up on the fact that this area of the brain is being used more. And because of that, just like if I lifted weights and used my biceps over and over and over, it's going to get bigger, it's going to get more robust, it's going to be more efficient at moving electricity, or in this case, my biceps, it's moving that mass. And so we'll actually jumpstart that part of the brain over the course of a 6-week course of treatment. And oftentimes in depression, it really helps with depression. In the addiction world, it does have FDA approval for smoking cessation. People who use TMS for smoking have a 30% higher likelihood of actually quitting.
Wow. Okay.
Yeah, which is a huge number. I mean, smoking, I think it's 1% of people who try quitting actually quit. So now we're increasing that by a whole third. And they've got research. I'm where I did residency, and what's right down the road from me is Medical University of South Carolina, and the guy who invented TMS actually works there, and they are a big research powerhouse, and they're currently trying to do research on cocaine, meth, and I can't remember if they're doing opiates, but there is active research specifically for substances of abuse, and it's really exciting to see what will happen.
So Miss Monica has a question. Excuse me, Monica has a question.
Hit me.
You're a southerner, man. You Miss Monica,
Uh-huh.
you're a southern guy. Hard.
He's making me feel old when he says that.
Just a brief, when I lived in New York, people said, don't call me Miss Sons or ma'am. Please do not call me that.
I know it's out of respect. Now, this is the first time I've heard of this, and I heard y'all also talking about the MAT treatment. But so the TMS, how new is this? Is it in its experimental stage? How often is it used? What age group? I mean, all that good stuff, because it sounds really interesting. And the pros and the cons.
It is, so it's actually pretty, it's been around since the 80s.
What?
It's been around since the 80s or 90s. It wasn't covered by insurance until about, it didn't become really mainstream until about probably 10 years ago, 10, 15 years ago. Insurance, so basically it was, people would pay cash out of pocket for it, and it was pretty pricey, probably on the order of, I don't know, $5,000 to $10,000 for a series. I would say almost every insurance now out there will cover TMS, though. It's FDA approved, and it's bona fide, it's legit. And there are more and more psychiatrists who are getting trained in it. It's been something that a lot of places just couldn't train because they didn't have anyone who's ever done it, so they just don't know how to. But yeah, it's a wonderful. I love TMS. I could talk all day about it. It's for treatment resistant depression. So this is people who have at least 2 or 3 medicines that they failed. Usually it's more on the order of like 6, 7, 8. There's a 70% chance that you're going to get better. Now, full recovery, not quite, but 70% chance of results, which in psychiatry is like really, really, really good. We usually work on the order of 1/3.
So people who are treatment resistant of various medications don't work, they have a positive response with this.
Yes.
That's great.
Yes.
Well, that's shows me that we can
Yes.
all do referrals across the board for those specific populations.
Yes.
100%.
So
Yes.
is it covered by Medicaid? I work with an MCO, and so our funding, or we're Medicaid. Our members are Medicaid clients, most of them. So is this something? Is it covered by private insurance at this point, or is it also? Because I've never heard of it, and I've been in this field for about 20 some years, and I don't remember. I don't remember hearing of this before.
So I just Googled it for you, and yep, Medicaid can cover TMS. It's not universally guaranteed, and it's state specific, but yes.
So something that's really specific to my understanding is that it is FDA approved. So with that being said, and it's been around such a long time, why is it just now becoming, did it just take a long time to get approved by the FDA to be approved for usage and insurance will cover? And there's that old insurance thing coming into the play of everything. And how long has it been FDA approved? And since that, how come it's just now being recognized as a positive influence in the depression area?
Yes, it is FDA approved. I'm looking at it. It looks like in 2008 is when it was approved for major depressive disorder. The things that made it move slow is price. It's expensive. I think an average series is about $7,000 to $8,000. And before it was cash only, and so it was only usually the wealthy who could afford it. And so I think it took a while to really catch on, essentially.
Well, I'm glad that that treatment is out there because I know I worked in a behavioral care unit and I met a young man who was in and out the hospital. It was like a cycle, and he was resistant to medications. And sadly, he ended his life by suicide. And his mother told me he wrote a note. His mother was telling me he wrote a note stating that he was just tired of living this way. I mean, I couldn't imagine a person who's in a state of depression, 24/7 and feeling the sense of hopelessness. So when you say that works, I think that's that. I mean, the word I use is awesome. Or even try to think of a better word for that. That there's some type of treatment out there for people who are resistant to medication. Because there's quite a few people who are, yeah.
Yeah. Yep.
Dr. Spencer, do you know whether or not that this procedure could be applied to people that have traumatic brain injuries? Is that something that has been explored or used?
I'm sure it's being explored. Because I would imagine if we can pinpoint exactly what part of the brain is atrophied because of a traumatic brain injury, you could stimulate it and get it to have a more robust. I am sure that is part of the research. There's also research for pain, chronic pain. There's research for it in PTSD. They've got all sorts of stuff. Anxiety. Yeah.
And are the levels of the revolution? You said that there's like 40 times. I don't know if you remember the term, the regulation of the amount of times that it happens. Is that just to deal with specifically with depression? And so if you had like a combined things to do with like anxiety, stress, depression, smoking, traumatic brain injury, if all that was combined into one, what's the difference then? Does it, you just adjust the dial and get a few more magnetory, structure of it? I mean, I don't know how to explain it because I'm brain.
Well, so you're doing a good job.
I'm over
Yeah.
I couldn't help it. I'm so sorry. I start. Yeah, listen. I'm over here.
I get what he's saying.
Yeah. But I love his question though, Dr. Spencer. He said, "Well, when we got all these, okay, let me professionally ask it because she's asking the same thing, right? Professionally, when you have all these comorbidities, right? Do you, and I'm gonna ask the question he asked, do you adjust it dial to like 80 time shocks, 40 time, like 45? Does that make sense? And
But he said it's not shock therapy.
no. But the I know it's not shock therapy, but that's the best way I can ask. So do we adjust the dial?
Pulses. Okay.
Pulses.
Reporting this, no, that's
Current, electrical currents, right?
Yep. So 40, my understanding is that 40 hertz is closest to the speed at which the brain talks to itself. Okay. So what we're doing is we're recreating the brain's natural pulse frequency, which is why it activates things. If we go down to 1 or 2 hertz, that actually deactivates things. So we can slow parts of the brain down. So some stuff that's not really clinical but is really cool is right. There's some studies for peak performance where they've slowed down some parts of the brain there, which made it so that other parts of the brain could kind of steal that area's energy. And I think the study was that it was people trying to hit baseballs, and they were I can't remember the number, but they significantly improved their ability to hit baseballs because they slowed down one part of the brain and then could steal that energy. And so that would be 1 or 2 hertz.
That makes complete sense because of the research that I've been doing as far as the human brain. We all know that there's little electric synapses that go on in between our cells and in the cell activity in our brains. So the difference between what you're accomplishing with this treatment is really, really an amazing and productive thing. It seems amazing to me, though. It just didn't get approved till 2008, and that's already 16 years ago. So this is a kind of a slow progressive thing that's getting developed, and I like I like the direction with what everything's going in with that.
And I think a big part of it too is it doesn't have the money that pharma has behind it for advertising.
Right.
Yes.
It's a device, and there's multiple device companies that make it, and therefore it just doesn't have the same. You don't see commercials for TMS machines or TMS treatment on wherever you see commercials.
Well, we can create one on the One Moment podcast.
That's right. That's right.
Hey,
Yeah.
we can create one. Hey, listen, I will show enough, spend the money, create one, and distribute it out on all social media accounts and pay for advertising.
Well,
Mental health awareness, and every issue that it helps involve its engagement with other people. Amazing thing to do. And
Oh yeah, no,
full support of-
absolutely.
I have a question.
mhm.
So is it only approved for major depressive disorder at this time? Is that the only people that are able to use this treatment? And the reason I ask, let me just add on, is because right now I serve the IDD population, right? And there are a lot of comorbidities that come with that. And, and there are different levels, as you know, in that population. I was thinking about one member that I serve, the aggression and the depression really hampers him. And it's like he's not getting better. He's getting worse. And then on top of that, he has a TBI. So, and it's sad because he's young. And so it's like we were trying to brainstorm the treatment team. We're trying to figure out how can we best serve him. And it's really hard because you got a whole lot of different things popping up. But that aggression and that and his mental health diagnoses are kind of hampering him.
Yeah, I would say major depression is its big thing. It also has indications for OCD, and it also has the indication for smoking. Recently, they got approval for anxious depression, which was they're trying to kind of move towards anxiety. So anxious depression. But as far as I'm aware, big things are OCD, MDD, anxious depression, and smoking. I guess technically there's also a device that you can put. It only does one pulse, but it's for migraines. But that's kind of besides the point.
Gotcha. Now, I do want to ask you some AI stuff, right?
Yeah.
Because you also mentioned that, but I don't want to move when we're not ready to move.
Yeah, whatever.
So, is everybody
The brain before you get into the AI that concern you don't mind?
No, I don't mind. That's why I was asking everybody else. Like, I wanted to kind of see where everybody else is.
Well, it's important because I'm getting towards that age and I'm concerned about that. When they talk about how about for us Alzheimer's and what have you? How about Alzheimer's and like, do you find that this is new? Like, can it stimulate and like not stop, but do something like slow the progression of Alzheimer's and all like that?
I'll bet you $100 someone's doing research on that.
Yes.
I don't know, but I'll bet you $100 there's someone who's making their PhD thesis on that exact subject.
Because I'm sure you heard this study. They was talking about how the brain, so much the brain, how it works, so we don't understand. Because I was reading, and you probably know more about it. There was a study that's called the Nun study. You know about that? There was supposedly, it was about Alzheimer's and whatever. There were these nuns, and they said they were very intelligent. They went to school, and even in their later years, they studied and they were pursuing academic goals and what have you. And so when they passed away, they found that in their brain they had this plaque. That there's precursor for Alzheimer's, I guess, and protein of plaque or something. But they also found that these these nuns didn't have any of the symptoms or the criteria for Alzheimer's or dementia, and that's because they say that when, and I might not be putting it right, when one part of the brain dies or whatever, there's other pathways that are built to compensate for that. So that's what they found. They did a study of these nuns, and that's what they trying to figure out. Maybe through them learning and learning new things and building new roadways or pathways, they didn't experience the onslaught that they should have with Alzheimer's.
Yeah, I believe it. Yeah, I mean, that's neuroplasticity. What you're talking about is that buzzword neuroplasticity. The brain can grow and change and adapt. And I mean, that's the whole reason that people who are born blind can see with their ears, right? They can hear things super well with their ears, or they can feel things really sensitive. The brain, when we look at their brains, the part that's made for seeing is incredibly atrophied because we don't need it. So there's no point. The brain's not going to feed it if it's not doing anything. And, you know, if I don't use my toe long enough, eventually it's going to fall off. I mean, kind of. And that area is replaced with other things and things that are being used more. So yeah, you're spot on. Yeah.
Wow. Okay. Thanks.
Okay. So anybody else? Because I got some great questions for you. All right. You mentioned building an app, you know, as far as that. Tell us a little bit more about that. And I also want to know too, because I did a here at NatCon, I did an AI, advanced AI concepts and ethics
Cool.
group, which is awesome and amazing. So, and I wanted to ask you some questions too in certain areas as it relates to AI, because it seems like that's your kind of also your other baby, right? And I say, you know, your other baby, like that's your other specialty,
Yeah.
right?
It's something I'm
So,
interested in.
so yeah, tell us about the app you built,
Yeah.
because you know if people want to use it, is it available to the public? How do they get it? Where do they find it from? Where do they find it? Things like that. Is it insurance, or what does insurance pay for it? Is it free? Things like that.
Yeah. So it is free. It has nothing to do with insurance. Anyone can use it. It is the website that will hook you up to then be able to get it is called EQ Unplugged. EQ, emotional intelligence, is also called EQ or emotional quotient, just like IQ, just emotional. And the birthplace of this was I was laying in bed with my little boy. He's 5, and I had the thought, man, I said something to him, and I didn't say anything bad or wrong by any means, but I said something to him, and the way I could have said it was I could have said it better. There's within child psychology, I was like, oh, I could have said that, and it would have made him feel more comfortable about sharing more with me. I didn't need someone to come and chastise me, but I'm always looking to be better, and I'm always looking to be the best dad I can. And I thought, man, wouldn't it be awesome if I could just have, Jimmy Cricket on my shoulder and he'd whisper in my ear feedback. And I got thinking, well, shoot, my phone is in my pocket pretty much 24/7. And I've got a friend who does some programming, and we put things together and so on and so forth. And so what the app does is it will listen to you. And my hope is it's used in all sorts of contexts. So the one I'm talking about is the context of like parents and when couples have a conversation and, they're struggling to actually truly communicate, right? They're saying words, but they're not communicating. Well, gosh, if you can have an app that can listen to you and then give you feedback and say, hey, the way you said this, I know you were trying to say this, but what came out was this. And then it's an unbiased third party. It's not your spouse's, sister. It's this app that really doesn't care who you are. It just knows what it heard. But then I also am hoping that it will be used in business context. I'm hoping that someone like you who does these interviews and stuff, right? If you were to record your interview, and then at the end of it get the feedback, it may say, hey, as someone who runs a podcast, you can ask, if you ask a question just a little bit different, if you add this word and maybe this sentence, you're going to elicit a stronger response from your person. It will be able to do that, and it'll also give you feedback on, for physicians. I'm hoping that it will listen to them and say, hey, you told this person they have cancer. You could have said it this way, and it would have made it so that they actually heard the diagnosis better. They would have been able to take it better. Stuff like
And I
that.
think they say practice makes perfect. With that app, over time, you learn to internalize that and you become more
Boom.
adept and apt at doing those things. Sure. Second
Boom.
nature.
And in therapy, right? You give your patients therapy homework, and they go home and either oftentimes they forget to do it, or they're when they get there, they're like, oh, like I had 2 times and I can only remember 1. Well, with this app, you will be able to type in and say, hey, I'm working on this week. Specifically try to hear those things. And then when they show up, they can give you literally 8 examples of, this is how I said it and this is what I did, and I know I could have done this.
So specifically,
great. I think that's great. And that's EQ Unplugged you go to, right?
EQ Unplugged. Yes.
Okay.
So specifically,
Is it .com, .org?
.com.
Okay.
Trevor, you've tried twice now. Go ahead.
Right. Specifically, what I'm thinking of is how this is going to be a real positive, explosive game changer in the sense of especially people with TBIs. Their
Oh, I love it.
their emotional cognitivity sensitivity, their emotional cognitive sensitivity is much diminished because of the effect that their impact of their brain has done inside their skulls. So, and my personal research that I am currently involved in is it's really showing me, it's like the light bulbs going off in my head with how important this really is right now into everything that we're discussing, especially how I tried to expound on the variety of different things that this can have an effect on. It is a strongly, hugely important advancement in how things are happening right now. So I can't say anything less than, wow, this is an amazing concept. The treatment capabilities that this can have, the opportunities for people who have been diminished in their capabilities of their lives, for cognitive understanding, for physical abilities. Just, I'm like, my traumatic brain injury brain is like going crazy with all this. So, so it's really a positive thing, and I'm glad to have even heard of it. What an amazing idea of work that you've got going on, Doctor, and just really total thumbs up on this one, man.
Well, thank you. Thank you.
Now, I'm fixing to throw a wrench in all of this. You ready for it?
Yeah.
Hit me.
All right. So we talk about ethics and AI, and AI is a huge, huge push, right? Like it's not coming, right? It's here.
Yep. It's here.
Regardless of whether people accept it or don't accept it. The room this morning was standing room, or this close to being standing room only, when I was there. So my question is how do ethics, right? Any type of ethics play a part into this app or into AI in general? You can answer it specifically to however you want to answer it, right? And what are some pros and cons, in this realm of AI, and since we're starting to see a more bigger boom with the indie healthcare industry?
So specific to my thing, I think one thing to say is it's depending on what state you're in, it is illegal to record a conversation with someone without their knowing consent. And so we have a disclaimer. If you're going to be recording people, you got to tell them because ethically that can get really sticky.
Mhm.
Another thing I thought of that you could kind of weaponize this, right? If you're having a conversation with your spouse and you don't tell them that you're using it, and then you turn around and then have it give all the critiques of them, and then you go and you tell them, oh well, you said this and this, and you could use it. It would no longer be an unbiased third party. It would be you cherry picking the mean things that it said. Um, so I think that, with great power comes with great responsibility.
Right.
On a broader term, AI in healthcare and ethics, I think my broad answer to just what we need to be cognizant of is we need to put the patients first. We need to put the patients first. We need to put the patients first. And as long as we're doing that with AI, we're going to be okay. Yeah.
I heard someone say that, like over the years, through Henry Ford with the cars and automobile, how it progressed over time. They say AI, the guy who came up with it, who invented, I use the word invented, he was talking about that there's not even ethics, laws and what have you, because it's moving at such a fast pace that it's difficult to. And the average person like myself had been watching these movies or sci-fi movies about AI. I saw one other day where this AI robot eventually collective they plot to take over the world. And the guy was saying some people actually believe that one day that AI is going to become so advanced that it might destroy us. And it sounds corny, but some people believe that. You know what I mean? Like because it's progressing so swiftly.
Mm-hmm. I mean, that's
So
Matrix.
That
yes,
that goes back to the movie Terminator,
yeah,
Yeah. Yeah.
yeah,
the
yeah,
original one. So
yeah,
yeah, you have to have your mind open and have the mindfulness of what kind of application is being
yeah, yeah.
done to the individual. So as long as you don't diminish their ability to make their own decision, and that's another problematic ethical thing right there, especially if you have a legal issue going on and you're in an environment where they don't allow you to make your own decisions. That is a dehumanizing thing to me. So the humanistic aspect of this is really difficult to approach. Human rights, for you being responsible of your being, is really important to remember that as advanced as this technology is, it is a great thing. But at the same time, does it have affecting? Does it have effects that hurt the person themselves without them wanting to have that done? So I don't know. I might be throwing a wrench in the works too, but I'm trying to think of this from especially in a secured environment, and they don't necessarily have the abilities to be able to make their own decisions, and so many of them get angry over it, and like dehumanization is actually happening right in front of you, and yet you have to enforce what the rules, regulations, policies, procedures are in your facility. So there's a whole avenue of conversations left to be done with this for certain.
What Dr. Spencer said is just remember, keep the patient firstly in mind and stuff like that. Because just as a general rule of thumb, we always say, like even our ethics as a counselor or therapist, do no harm to the patient, and that's important.
Absolutely.
Yeah.
So, Dr. Spencer, my question, I'm going to give you a question and then a statement, okay? Here, like we always do in every episode. When somebody's watching this episode and or watching these clips, what is one thing you want them to take away from it, from you being up here, from the knowledge that you've shared? Because we've asked you a bunch of questions about your experience, across the board here. I mean, we've talked about different things here, all great information too, and of course necessary for the public. So, what is one thing that you want the audience to take away and then give us a call to action. What is it that you want people to do?
I would say we had two sections to this conversation, so I'll answer the question twice. One, we talked a lot about that TMS. There's hope. If you're someone who feels like you've tried everything and you've been through the whole gamut, the brain is an electrochemical organ. It uses electricity, it uses chemicals. We do a whole bunch of giving chemicals, all the pills that we give. Maybe it's time to try the electrical side. And there is hope, and that is there. And please don't feel like there's no other options. From the other side of things, so the AI, I guess from a selfish standpoint, I'm really passionate about emotional intelligence, and there's a lot of phenomenal evidence about kids who grow up emotionally intelligent. They do better in school. They have lower rates of substance use. They lower rates of depression. So if we can, and as we as adults, if we can develop it, that we model it for our children. And so I would say use EQ Unplugged. It is free. It's a powerful tool, and it's kind of fun. It's fun to have when it's you and just you, and no one else is going to see all the critiques. It's really fun to see how you engage with the world and what it is that. So I would say use it, and learn about yourself. Learn, because you learn things about who you are and how you think through it. Those two, and then a call to action: never stop developing, never stop bettering yourself. We are here on this earth, and we've only got one shot, and just keep growing, just keep building, because you leave behind your legacy, and your legacy is it's the people you touched, and the best way to touch more people is to learn more so that you can be a better tool.
Sure. We appreciate that. That's inspiration. Yeah.
Absolutely. I love it. Thank you, Dr. Spencer. Been an absolute privilege and honor having you on the show. Monica, absolutely having you join in. You asked a lot of good questions relating to population and all of that. Trevor, you asked about spinning the dial, readjusting the dial. I loved it. And then to throw the icing on top, Ruben, you just threw it off on, well, this affects me right now because I'm getting on up there in age. So anyways, thank y'all. I appreciate it.
Hey, it was
But
great.
I appreciate you coming on as well.
Does anyone else have that one tool that makes building a website a breeze? In an era driven by digital change, WebHash is the indispensable tool that holds the key to effortless website creation. Create websites that endure, defy censorship, and bypass any single point of failure. As cutting-edge technology redefines reality, seize the power to build beyond limits. Join the Web3 revolution now and forge paths others can only dream of. Visit our site today and build your legacy. Building my own space on the web was always a grind until I hit up WebHash. Their no-code builder is my ace. It's swift and solid. It's like rocking a digital fortress that's immune to the typical shutdowns. Level up your web presence without stress. Ready to stake your claim in the digital realm? Dive into WebHash today, connect your Web3 wallet, and get started. They have multiple subscription plans, from a free version to a lifetime subscription. Check them out today at webhash.com. Most importantly, they sponsor the One Moment podcast, helping to raise awareness to critical topics in the healthcare field. Our official website was built using the WebHash platform. Throughout the projects that the One Moment movement built on WebHash, they stood behind and supported it all the way. Sign up and start building your website today. Don't forget to visit onemoment.chain.box and subscribe to our social media channels.